Good morning, everyone. It is 10 o'clock and it is time for our twice a month coronavirus virtual information session. We moved to once every 2 weeks, so this is nice to have everyone back. Thank you all for being with us today. Let's just go to the next slide. We're going to keep the microphones on mute. So if you have any concerns about your health, please call us at 588-4340, or you can call the COVID-19 hotline at 800-722-5725. If you have any question, please type it in the chat, because we will then go through those questions one by one after our speaker has talked. Next slide, please. If you have any issues with your sound, you can just follow this arrow that you can see here, and it will help you figure out what is the issue. And then last slide, I believe, is please type the county into the chat, the county that you are representing, either where you live or you work, to give us an idea of how far our reach is going. So today we are really excited to welcome Mark Carter, the Executive Advisor from the Kentucky Cabinet for Health and Family Services in the Office of the Secretary. And he is going to talk a little bit with us about the Kentucky COVID-19 contract tracing program, addressing the importance, purpose, and misconceptions. He's going to share an overview, and then he's going to tell us what to expect if you are contacted, how the program works, and any misconceptions that really is going on there. So with that, I am first, just before he starts, Mark, I'm going to ask Dr. Furman, our medical director, to give us a quick update as to how things are going in the state of Kentucky.
Hello, everybody. I'm Christian Furman. I'm the medical director of the Traeger Institute. So thanks for having me. I just want to say in general, kind of an update on the numbers. So in Kentucky, there's 39,691 cases and 818 deaths. So it's a lot. In the U.S., there's 5,488 cases and 172,000 deaths. You know, the schools opening, a lot of students are going back to college, and it's been stressful for a lot of people. So I think we talked about this yesterday, Mona and Barbara, in your taking care of your health program, but that you got to still be compassionate. It's a lot of stress on families going back to school. So I think we just want to remember that this is a stressful time. The Kentucky schools, the governor asked everybody to wait until September 28th to have in-person. So most Kentucky schools are online, but private schools are doing a lot of the hybrid. So everybody's doing something different. So just kind of bear with everybody, be compassionate. A lot of people are having to switch a lot and try something and switch to something else. Our positivity rate in the state of Kentucky is 5.87%. It started at 2%, went to 4%, went to 5%. It actually got up to 6% at one point, so it's down a little bit to 5.87%, but it's still a high positivity rate. It's not as much as some states. Some states are 15%, and those are the states the governor has asked people to self-quarantine for 14 days when they come back. So that's Florida, Nevada, Mississippi, Idaho, South Carolina, Texas, Alabama, and Arizona. Just about the nursing home update, the nursing homes are still doing this maintenance testing every 2 weeks. Like half the nursing home usually test on week 1 and half the nursing home on week 2. It's just the staff and the vendors that are being tested. It's not the patients that are being tested, because the patients have all been tested, and we now know, and they're testing certain, the patients aren't coming and going, the patients are just staying there. And so if the staff person tests positive, they're testing the patients that staff person had contact with, and the state's paying for all that testing. So it's going really well to have that testing. Also, just want to let you know the governor did an executive order and worked it out with the Secretary of State, Michael Adams, about voting. So the general election is November 3rd, and they did approve absentee ballot by mail, early voting, and election day voting, the details. So all that's online, but they also agreed to that, a lot of people couldn't get their ID because a lot of the state federal offices were closed. So they are going to let you sign a document saying this is who you are. So the IDs will not be a barrier to voting. And then just remember the businesses and restaurants, they're at 50% capacity. Everybody has to be 6 feet apart. The restaurants are supposed to stop serving at 10 p.m. and close at 11 p.m. So that's a little bit of the update. The big thing is to keep wearing your mask, stay 6 feet away, wash your hands, face, space, and be compassionate and kind to your family and friends and work colleagues. So, yes, so Mark had his mask, so I'll turn it over to you, Mark, and it's good to see you, and thanks for all your work you're doing with this contact tracing.
Thank you, Dr. Furman.
Yes,
just
go ahead,
before we
go ahead.
Mark, I just want to tell people a little bit about Mark. So Mark, sorry, but let me just tell everyone who you are. So Mark has joined the Office of the Secretary of the Cabinet for Health and Family Services as an executive advisor, leading the contact tracing program. He will work closely with the Department for Public Health Commissioner, Dr. Stephen Stack, and public health staff as part of the Healthy at Work approach to reopening Kentucky. Mark is a certified public accountant and has 40 years experience in the healthcare industry. Most recently, he was Chief Executive Officer of Passport Health Plan. Prior to that, he served as Chief Financial Officer at Jewish Hospital and was a partner with Ernst & Young. He has served as the President of the Kentucky Healthcare Financial Management Association and Chief of the Foundation for a Healthy Kentucky. He's a member of the Board of Directors of Supplies Overseas, Simmons College of Kentucky, Spalding University, and a Foundation for a Healthy Kentucky. He is a graduate of the University of Kentucky and an accomplished private pilot. I didn't know that about you, Mark. He and his wife, Kelly, lives in Prospect. They have 3 adult children and 6 grandchildren. Cabinet for Health and Family Secretary, Dr. Friedlander said, "We are beyond pleased to welcome Mark to Team Kentucky. His healthcare strategy and leadership experience has helped Kentuckians for many years, and his leadership in this new role could not have come at a more important time as we continue to reopen Kentucky for business." We are really just so privileged to have you with us, Mark. So thank you for being with us, and you have the floor.
Well, thank you, Anna. I always, when I listen to that, I always wish my mother could hear that introduction, but unfortunately she can't. I'm pleased to be with you. As I think Dr. Furman knows, I had kind of decided to sort of retire, although I wasn't going to completely retire. I was going to do some consulting and the like, and then COVID rolled around, and obviously at least for me, the election last November in Kentucky turned out the way I wanted. And so this opportunity came up, and I was, I didn't really hesitate. I think that this is probably one of the most important health crises that we've faced as a country, certainly in a century. And, the opportunity to provide some leadership in that capacity was just something I really couldn't pass up. I will tell you that right before I got on the call, I was trying to change my virtual background to put the U of L administration building on there to sort of mute that University of Kentucky background, but I just settled for Cumberland Falls, so you'll have to bear with me. I thought what I would do is just spend a few minutes talking about contact tracing, generally what the federal response has been, and then what we've been doing here in Kentucky, maybe spend 15 minutes or so and then open it up for questions and answers. It's been a really interesting journey for me. I knew public health, but not at the level that I know it now after 3 months of being in the Department of Public Health in Frankfurt. And so it's been a learning experience for me, as well as an opportunity to be of service to the Commonwealth. So let me talk about contact tracing just to start out. I think for most folks on the call, I think you, like me, have a basic understanding of contact tracing, but essentially what it is, it's a public health tool that's been used for decades to contain communicable diseases. And where this is probably the most well known to the public is in something like tuberculosis. Essentially, the diseases like that are required to be reported. A diagnosis of that disease is required to be reported to the local health department, either by the clinician that makes the diagnosis or by a laboratory that does the testing, which is important in the case of COVID. When a patient is, a diagnosis and a patient's name is reported to the local health department, they launch a disease investigation, which essentially involves a clinician, usually a registered nurse, who calls the individual that has been diagnosed and does an interview with them. And for the most part, that interview revolves around that individual and what they need to do in terms of interacting with their provider, in terms of self-isolating so that they don't spread the disease to others, whether they have daily needs for things like groceries or childcare, or access to medicines, those kinds of things. But then also involves really getting an inventory of the folks that that patient may have come in contact with while they were, spreading or infectious, I guess. And so those contacts then become the subject of the contact tracing effort. And so they're passed on to a contact tracer who would then the contact tracer and the clinician would make an assessment of the relative risk that those contacts had come into. But then the tracer would call the contacts, have a similar conversation with them around what they need to do to quarantine, what kind of daily needs they might have, and the like, and would basically advise that individual on what they need to do to contain the disease. This has been done in local health departments for decades. In fact, perhaps since there has been a local health department, contact tracing has been a key tool of health departments. And the more recent activity, you still see tuberculosis, but HIV, sexually transmitted diseases, and those kinds of things were, generally the subject of disease investigations and contact tracing in local health departments prior to COVID arriving on our shores. In terms of the federal response, that has been embodied in the CARES Act, and Kentucky received over $100 million in funding from the CARES Act back in the April timeframe. And, among other things, and in addition to the money, one of the things that the feds intended to be funded under the CARES Act was a robust contact tracing effort as a way to contain the disease. Here in Kentucky, that basically boiled down to three general approaches. One was just staffing. There were about 430 professionals working in local health departments across the Commonwealth back in March that were doing disease investigation and contact tracing work. So we didn't start from zero. We actually had a number of folks that were working in this area, but of course they were busy, believe it or not. So what we've done in terms of the first prong of the response as relates to contact tracing was to staff up. As of last Thursday, we have about 1,100 professionals in Kentucky doing contact tracing and disease investigation. So over 600, or right at 600 staff have been added really since about the 1st of May. So that's a considerable lift there to to stand up that level of contact tracing staffing across the Commonwealth. Interestingly, the Kentucky Department of Health is responsible for all but 119 counties. Actually, the Louisville Metro Health Department has its own CARES Act funding. And so the Jefferson County effort has been coordinated through the local Board of Health and the Metro Health Department under the leadership of Dr. Moyer. Just in Louisville, there are 100 contact tracers that have been added to that health department alone. That's included in the 600 number that I gave you a minute ago. And Louisville actually at the moment is planning to double their staffing and contact tracing really to meet the demands that they face with the spread of the disease in Jefferson County alone. So one aspect of it has been staffing, and I feel, frankly, pretty good about that. I think we have a combination of maybe 20 or so folks that have been added in Frankfurt in the Department of Public Health that are in either leadership roles overseeing the staff, or they are analysts and epidemiologists who are studying the disease and how it's, how it's spreading and where it's spreading, and, the kinds of things that epidemiologists do. And then we have a regional team that is basically floats between local geographies depending upon hotspots and outbreaks. That numbers about 100 people. And then, but most of the new staff have been embedded in the 61 local health departments across Kentucky. So most of the folks we've hired out of local communities. They know their local community. In many cases, sometimes when they make calls, they know the folks that they're calling. There's probably a Kentucky joke in there somewhere, but I won't make it. But nevertheless, the staffing aspect of it has been, I think, very well done and effective. The second piece of it is a consistent information system, which we call the contact tracing and tracking system, or the CTT system. That's our acronym. And the idea there was, if you looked at how the actual work of a contact tracer was documented and then fed into databases in Frankfurt and at the CDC, it ranged from everything from paper, Excel spreadsheets. There is a system called REDCap that was developed at Vanderbilt University that a couple of health departments used, but it was all over the board in terms of just the information process and a very, data-rich activity across the Commonwealth. And it just depended upon the size and the scale, the funding, the sophistication of the individual health department as to what that looked like. So one of the things that Dr. Stack and Governor Beshear wanted to do with the CARES money was to build a consistent statewide information platform, which is what the CTT is. The idea there was, if we could do that and everybody was on a consistent platform, it would be similar to, Southwest Airlines flying nothing but 737s with a particular panel set up, so they could have pilots, that no matter where they move them, they could fly the same aircraft. And that's the thinking behind the CTT system. So we set about in early May, really before I even came on board, building this system. It's built on a Salesforce platform. It's cloud-based, so it's all state-of-the-art. It's not dependent upon some clunky mainframe in Frankfurt or, Fortran or COBOL programming. The one thing about being around 40 years is I know what Fortran and COBOL are. But nevertheless, it's a pretty slick system. And so that was built very quickly. It was deployed across the state around the end of May. We had a soft launch. The Louisville Health Department in particular, just, props to them. They adopted the system very early and have become really super users in using the system. Like any system, it has it has its issues. So, you have to stand something up very quickly. You have to make decisions about functionality that can be added later versus what the minimum is that you can put in place to start with. And so the stand up on it has not gone as smoothly as the staffing from my perspective, but by the end of this month, by August 31st, in a couple of weeks, that system will be deployed in all but one of the health departments across the Commonwealth, and that one will stand up in by about September 15th. They had some particular challenges because of a significant outbreak in their community. So, and then we continue to improve that system. Every 2 weeks we do updates and add functionality and features to the system. So that, and when you think about your own experiences with system changes, to start at the 1st of May and to have it deployed across the entire state in 60 of 61 departments by the end of August is a pretty significant accomplishment. My biggest frustration has just been that I think we could have gone faster. And then the last of the 3 issues that I think we've done a nice job with this, but it's a challenge, and that's communications. As you all know, there is so much information out there, and unfortunately, a significant percentage of it is just flat out inaccurate. And we've struggled a little bit with a fairly sizable percentage of our population here in the state that is extremely distrustful of government, particularly the federal government, but also the state government. It becomes less so as you get down into the county and city level, but nevertheless, that's there. And so narratives were emerging that contact tracing, we were going to put an app on your phone, and we would know, the folks in Frankfurt would know every time you went to the restroom, and stuff like that. And of course, now after spending 3 months in Frankfurt, I can see the absurdity of that, that argument up close, because I'm not sure we, 1, had the orientation towards doing something like that, or 2, we certainly don't have the capabilities. So a lot of what we've had to do is to really think about how we communicate just what contact tracing is and isn't. Various constituencies. How do you talk to, county judges versus, a local Rotary community, those kinds of things. I think that if you look at the COVID-19.ky.gov website, where a lot of our collateral is housed, you'll see that there is significant communications collateral there, including a public service announcement toolkit that can be used by any citizen that wants to communicate around the effectiveness of contact tracing. And I would just emphasize that's just one component of the public health response, but it's an important component. And it's important that folks understand what it is and what it isn't, and the importance of answering a call if you get one from the health department, listening to the advice that you receive and acting on it, and really being doing your duty as a citizen of the Commonwealth to stop the spread of COVID-19. So that's been a bit of a challenge. We've, things like fraud, it just blows my mind that there are people in our society that will take advantage of a situation like this to defraud folks, and they prey on the vulnerable and the elderly. Obviously, as get victimized by that kind of thing at an unconscionable level. So we've spent a lot of our communications talking about just what a contact tracer will ask and what they won't ask. They won't ask for any financial information, bank account information, social security numbers. It'll just be around the diagnosis or the nature of the exposure they've had, and what they need to do to protect themselves and their loved ones from the spread of COVID. Last thing is, I would just, or 2 comments. One is I would say that, while my focus is on contact tracing, the public health response is obviously far broader than that. Dr. Furman mentioned the wearing of masks. We obviously the public health messages: wear that mask, stay 6 feet away from folks, avoid large crowds and gatherings. Testing is a component. All of these things have to work together to contain the spread. And frankly, it is disconcerting to go into, retail establishments and see, you know, a large percentage of folks not wearing a mask, because if we don't follow those guidelines around social distancing, masking, testing, it won't matter. We could have 2,000 contact tracers and it simply won't matter. The disease will spread. My fear is that we've kind of hit a testing, perhaps a ceiling in testing, and that the disease is spreading faster than what our testing is revealing. And so that positivity rate, you know, may be a little deceiving. So, so that's one message. And then the final thing is just, again, I think that the Kentucky public health response kind of speaks for itself. If you, every day, Doug Thurman, who is the CDC epidemiologist that's embedded in Frankfurt, and he's the acting chief epidemiologist for the state, he puts out about a 25-page report that looks at the spread of COVID and where we stand. And, you know, there's one page in there that shows the map of the United States and the status of the 50 states in terms of the spread of the disease and where the states stand. And Kentucky, and the only state that's better than Kentucky in terms of the spread of the disease, is West Virginia. And I would argue that's because there's nobody in West Virginia. But so, you know, I think we can all be proud of the response that we've had in the Commonwealth. And I give a lot of credit to the governor for that. I think that at least to the extent that I've been involved in the discussions, you know, he tries to make his decisions based upon the advice of the public health professionals that are around him. I think Dr. Stack, and this is just not a commercial, but I think Dr. Stack, I don't know how that happened, but he was the right guy to have in that spot when this hit. He's by background an emergency room physician. So, you know, he's used to dealing with crises. I don't think that he imagined that he would be, I know he didn't imagine that he would be dealing with a crisis like this, but his leadership has been steady. He's made good decisions by and large. And, you know, I think if we can just rally our citizens to do the right things in terms of the response, I think we can continue to perform very well against the rest of the country in terms of how we're containing the disease. So with that, Anna, I'll stop here and open it up for Q&A.
Thank you, Mark. Yeah, there's quite a few statements and questions in the chat. I'm going to start with something that's not particularly related to contact tracing, but I think it's an important announcement to make from Andrea, who's saying that she's collaborating with the Kentucky Commission for Human Rights and the Louisville Urban League to create easy-to-read forms of all the voting options, websites, phone numbers, and voters' rights. They will be distributed to underserved communities and those who don't have access to the internet or perhaps are not internet savvy, to make sure they know of these updated voting options. We will also encourage small businesses to post these, and we'll keep you all posted when the materials are ready. And this is great work, so please let us know when you have anything that we can also advertise on our behalf, and we can send it out to everyone. Thank you. So here's the first question, and that's from me to you, Mark. Must the patient report a positive test to the health department? We had someone testing positive, and it was not clear what the next procedures need to be to start contact tracing.
Yeah, well, the rules under public health are that either the provider that makes the diagnosis has to report that diagnosis and that patient to the health department or the laboratory. And more typically with COVID, it's been the laboratory that makes the report. So when a lab has a positive case, that gets reported. If you're in Jefferson County, it gets reported to the local Board of Health, or the health department rather, in Jefferson County. And then that starts the process of getting it entered into the database. There is a system that the CDC uses that has to be, you know, that case has to be entered into. And then that starts the process of the disease investigation and the contact tracing effort.
Is the county based on where the patient lives or where he was tested?
Well, that's been one of the rough areas in testing. It is intended to be at the county that the patient lives in, but the patient doesn't always get tested in that county. We've seen that in Franklin County with a lot of folks that live in Fayette County or Jefferson County, Shelby County. I think that's been smoothed out now to where if the test occurs, say in Franklin County, and the person lives in Shelby County, then that's immediately transferred to the Shelby County Health Department to follow up with that patient.
Does that also apply to people who get tested in Cincinnati? Because there's a lot of people just that live so close to Cincinnati. That's in another state.
Same thing. But that started out a little rough because you can just imagine the number of sort of different scenarios that arose. But that's also evened out. I think at least here in Louisville, with the health departments across the river in Indiana, I think there's good communication now, and the cases do get transferred timely so they can be followed up on.
Okay, thank you. Now, are you coming across older adults that are scared about privacy issues when someone calls them as part of contact tracing?
Mm-hmm. Yeah, one of the things that we've done, and this just went live across the Commonwealth this past week, is we set up a single phone number. It's 1-844-KY-TRACE. And that typically what will happen is the individual would receive a call, and it would come from the health department. The initial call would come from the health department. Now we're working on the technology to try to have, all the calls that go out come from that 800 number. That would be identifiable on your mobile device. When it comes up, it would say 844-KY-TRACE. And unfortunately, that's technically more difficult than I guess any of us thought it would be because of the different carriers and different rules. But we are working on that, and at some point we'll be able to do it. But right now, the call is going to come from a 583 exchange from downtown Louisville. If you're here in Jefferson County, come into the phone. A lot of people don't answer the first when they don't recognize the number. I know I don't. And but the person would leave a message that they're from the health department, and they would leave the callback. They'll start using the KY-TRACE callback number, and then when the person calls back, they'll ask. I think there'll be a queue that asks for the zip code. And then based upon the zip code and some logic we've written into that, where you have cross-county zip codes and the like, it'll route it to the proper health department, route that call to the proper health department.
Yeah, okay, thank you. So Andrea's asking, will tracers reach out to businesses that a COVID plus individual has visited in the recent history, or just individual contacts?
Well, typically on an individual, so if there's a contact and the person is going to, either a contact that's going to have to quarantine or a patient that's going to have to isolate, they will get a written email or letter from the health department that's, it basically can be used as the excuse not to come to work. And, there's going to be some incentive for the individual to let their employer know that they're having to isolate or quarantine. Now, in the case of if there's this outbreak in I guess what you would call a high risk type employer, so a chicken processing plant or a manufacturer where there's a lot of people working close together, the local health department, the chief epidemiologist there and the director would exercise some judgment around whether or not they ought to call the employer and talk to them specifically. So if it were a school, like I said, a meat processing plant, places where we know people are working very closely together and there's a high likelihood that there would be multiple contacts and multiple incidences of positive tests, then the local health department is going to talk to that employer to try to, enlist them in stopping the spread and helping them keep their business open, frankly.
Yeah.
So it just kind of, it's going to be facts and circumstances dependent.
Yeah. So, but what if that contact tracer is finding out that I test positive and I went to some kind of a business, I let my car be cleaned, something like that. Do you contact those kind of businesses as well?
It kind of depends. You know, if they went to Kroger to the grocery, you know, they're going to ask, the tracer is going to ask the person about their behavior. Did they wear a mask? How long were they in Kroger? Did they stop and talk to anybody? You know, in that kind of case, that would probably be judged as low risk, and there wouldn't be any contact with the Kroger. On the other hand, if it were a Kroger employee that worked as the cashier, you know, that came in contact with a lot of customers, then we would. So again, it's not as cut and dry. It's hard to, all of this is risk mitigation, and it's really, it's hard to anticipate every single instance and have written guidance on every single instance. But the local health departments are the closest to the folks in their community and are in the best position to make, you know, make those kind of calls.
From Barbara. Barbara's asking, there seems to be some confusion concerning contact tracing and instructions provided to a person who tests positive and those who live in the same household. What is the basic protocol for someone testing positive and the people who live in the same house? For example, should the wife of a husband who tested positive also be tested? How do you determine who should be tested or not for the people the person who has tested positive has been in contact with?
Well, the typical advice is that if you're in a household, and I think you've seen this in some highly public cases here in Louisville, particularly after the Speed Museum set of cases, but typically what we would advise is that if it's a married couple, the husband tests is positive, then he should separate himself, and let's say they can't, you know, they have to be in the same house, then he should separate himself from the rest of the family in an area of the house and be, you know, just kept separate. So if that's the bedroom or the basement or whatever it is, you just don't leave until until your isolation period has passed or your symptoms have passed. And then for the other household members, they're considered contacts. And they would probably typically be considered at a high risk of exposure. So it would be suggested, and I use words like suggested, there's actually public health orders around this. I just don't like the directive nature of that. But, you know, the other family members would be expected to quarantine themselves from others, you know, within the house, and then watch for symptoms. Now, the issue of testing, I think our guidance typically would be that absent symptoms, that we don't think that it's necessarily, well, it's not necessary to be tested absent any symptoms. Now, I know that doesn't necessarily reconcile with some of the public statements around everybody should get tested and the like, but the fact is we have a testing capacity limitation in our country and our community. And so, you know, our typical advice is absence, you know, don't test asymptomatic people. Now, if the folks in the family feel that just to protect themselves and for, you know, their own comfort and peace of mind, or to protect their, you know, their parents or, you know, other folks that they may have come in contact that they want to be tested, then they should, you know, they just make that judgment and go get tested. But typically we basically do not advise getting tested if you're asymptomatic.
And then Mark, if they're tested and then if they go get tested and then they're negative, do they still have to quarantine, or once you're tested negative, that's it? It seems like you should still quarantine, or I don't know.
No, they should still quarantine. And the reason for that is, as you know, Dr. Furman, you could test negative on Tuesday and go back and test again on Wednesday and you test positive. It's just the way the disease presents. I mean, you can have the virus but it hasn't multiplied enough in your system, and I'm getting out of my league here, but that you could have the virus and still test negative, and then the next day there's sufficient virus in your system that you test positive. So the quarantine period would still be in effect, and that's just, unfortunately, it's just the way it is in terms of trying to protect folks from spreading, or protect folks from getting the disease.
So Mark, how long is the quarantine period?
Well, the CDC just came out with new guidance about a week and a half ago, and I think that's up now on our website. But it's a 10-day quarantine period, and then I think the return to work is another 2 days without any symptoms after the 10-day quarantine period. But right now it's 10 days.
Yeah, so I guess I learned something this morning, because I always understood that if you have been exposed to someone, even though you are asymptomatic, you should get tested, because you yourself could be a carrier, because you could be asymptomatic, but you could have it. But you are suggesting you just quarantine and you do not get tested.
That's right. Yeah.
And that's because of the lack of testing?
Well, I think it's generally, I think what the public health position on it is to try to, we believe we have a testing capacity issue still in the country. And in fact, I think if you follow the trades and some of the popular press, it's pretty clear that that's an issue. And so just certainly mass testing of asymptomatic folks is clearly not advised. I know the University of Kentucky, they're testing 30,000 incoming students, whether they've had symptoms or not. That's using a lot of testing capacity for folks that are exposed, where a test would be indicated. And so we're trying to help folks understand the issue so that asymptomatic people aren't tested, in mass testing events like that. And when it's an individual, when it's a family, it's more of a judgment call. I don't think that we would discourage necessarily testing. It's just not something that we're advising if there's no symptoms.
Mm-hmm. Okay, Natalie is asking, are there any scams that are pretending to be related to contact tracing? Are there any questions that contact tracers will not ask over the phone? I know you already talked about the financial and social security. Is there any other thing, anything else about this?
No, I haven't had, any specific scams that have been reported to me. We've been encouraging that when those come in, that they are reported to the Attorney General's fraud hotline. But it's typically, if someone calls from the health department and they start asking you for personal financial information, credit cards, there's never any payment associated with any of this. So anything that would go towards a person's financial resources or their social security information, anything like that, we're advising folks, hang up and call the Attorney General's fraud hotline and report the call. The health department is just going to ask about, if you've received the diagnosis, obviously they're going to know that, and so they're going to talk to you about, what types of symptoms that you can expect with COVID, how to manage your illness, when to call your physician, or when you should go to the emergency room if the conditions get worse or unmanageable, those kinds of things. An interview about contacts, and even then on the contacts, they're just going to try to identify the individual. They may ask for a phone number if the person has it, but we don't even really have to have that. We can find phone numbers and email addresses through technology. Same thing with the contacts. The call would say, the person would tell the individual that they've been exposed to COVID-19 through, an individual that they came into contact with, won't disclose the name of the individual. so the privacy is protected. And then they will do the same thing. They'll talk to the person about what kind of symptoms that they should watch for. They'll interview them in terms of, given that they're going to have to quarantine, if it's been determined that they need to quarantine, things like medicines and food and childcare, and, do they have needs like that? And then trying to connect them to the proper, to an agency that can help them with those things. So
yeah.
no financial information, no Social Security. If that even comes up, it's time to hang up.
Okay, thank you. My question to you is, what's your opinion about the opening of public universities in Kentucky?
Well, I don't know. It's, just from a pure public health standpoint, it just seems to me to be premature. But I don't think you can look at those kinds of decisions just through the pure public health lens. I mean, there are broader issues around education and the economy that I think have to be taken into consideration. While we don't think that the University of Kentucky's decision to test all their incoming students was necessary, you do have to kind of give them credit for taking a holistic approach, trying to keep the students of their university safe. And, so it's hard to be too critical. I just, noting that the University of North Carolina yesterday decided after 135 cases to just go to virtual, I think is probably instructive. I just know how I behaved, at least socially, when I was in college. College kids just don't do a whole lot of social distancing. And so I don't know. Like I said, if you just look at it with a public health lens, it's pretty clear that, we probably should stay with virtual learning, at least for another month or two. But, it's a tougher call when you think about it more broadly.
Yeah, yeah. Mary Kay is asking, early on there was talk of employing some of the many unemployed due to COVID-19 as contact tracers. Is there still a consideration?
Yes. Actually, interestingly enough, the way that we staff these positions initially was using staffing agencies. We basically, the Kentucky Department of Public Health, and this decision was made before I arrived, although I would have made the same one. But because the federal funds were coming to the state, there was a need for the department to have some level of control over the hiring and onboarding and training of folks. Then we did that through staffing agencies. And in part because of the speed and the fact that we were hiring from all over the Commonwealth, there are multiple staffing agencies that were engaged in that effort. The hiring process, while it was highly centralized, we left the hiring decision to the local health departments. So either the director at the local health department or the human resources director, if it were one of the districts that had those kinds of capabilities, would make those decisions. And, we did encourage them to hire from the local community, to hire a diverse workforce. We encouraged bilingual tracers, particularly Spanish as a second language, but not just Spanish. And we did suggest that if it were a person that were unemployed, that they be given first consideration. We didn't want to hire nurses from the local hospital that already had jobs, for example. There were 7,000 applications submitted to the agencies for, at the time we said 700 positions. Now, and that's for the 119 counties that the state's responsible for. I don't know the numbers in Jefferson County in terms of how many applications they had, but ultimately they'll hire 200 tracers. And I imagine they had thousands of applications also. So certainly the state of the economy had something to do with that. with that level. But
Yeah.
I guess the good side from the Department of Public Health standpoint is there wasn't a dearth of qualified candidates.
Mm-hmm. Question to you from me. Did the governor turn soft by allowing the Kentucky Derby to happen with spectators?
Christian's smiling. I was not a party to that decision, so I don't know exactly what went into it. I'm certain that the folks at Churchill Downs made representations around how they were going to accomplish social distancing, and meet the requirements, or at least the guidelines that the governor's office and the Department of Public Health has published. I don't know how to assess 23,000 attendees in a venue that can host 150,000. It seems like that you could probably figure out how to have the right social distancing and the like, but
yeah, they're not gonna allow, there's no general admission tickets, where you just
Right.
got a ticket and you just kind of walked around and wandered, there's no more
Right.
general admission, and there's no more infield admission. So
Right.
what they did is they bought back all the tickets for people that didn't want to go. Like my husband and I had tickets to Derby. We didn't want to go. They bought them back from us. And then they looked at all the tickets they had, and then they moved them around so everybody's 6 feet apart. So they were smart about it. I mean, it's always a problem because people probably aren't going to do what they're supposed to do, but they're supposed to wear a mask, stay 6 feet apart. I mean, you can't actually make it work, but I'm
Right.
glad they closed the infield and closed general admission. I mean, that makes sense.
Yeah. I haven't been a party to those discussions, so I can legitimately dodge that question.
That's fine. Natalie has posted some supporting resources that you gave her, so you can look in the chat and find those. Joe is asking this question: what's the biggest impediment that the state is finding for people that don't want to wear masks?
That's a great question. I mean, it's I don't know. I just in the community, in the part of the community that I live in, and Dr. Furman and I live in the same neighborhood. I mean, I see a high degree of compliance. If I go to Kroger here, if you're not wearing a mask, or if you're not wearing it appropriately, you kind of stand out. But my brother and I have a place down on Lake Cumberland near Somerset. And if I go to Kroger in Somerset, half the people in there aren't wearing masks. And I just don't understand it. I mean, I think it's part of the polarization that exists in the media today and social media, and folks believing that they have a right not to wear a mask and that this whole thing is overblown. I mean, it's just simply not overblown. Being inside a Department of Public Health like we have in Frankfurt, with really a committed bunch of people. I mean, there are epidemiologists and physicians and analysts that study these kinds of things. I don't know. I don't know that I have a good explanation for it, except that it's a reflection of the division in our society today that somehow we have to find our way past.
Yeah. And the next part of his question is, what steps are being taken to increase the time it takes to get test results?
Well, if you look at, and I don't typically I shouldn't say this, but I don't typically watch the governor's press conference every day, but I did happen to watch it yesterday, and Dr. Stack was talking about testing, and he showed a graph that kind of showed, what had been done here in terms of increasing the capacity for testing in the Commonwealth. And, he pretty much single-handedly led that effort. He had delegated the contact tracing to some of his staff before I came in, and he just took the testing thing and owned it. And the way he addressed it was he entered into 2 significant contracts, one with a lab called Gravity and the other with a lab that I believe is headquartered here in Louisville called Blue Water. And basically bought capacity. He just bought their capacity and used the CARES funding to do that. And that's how he ramped the testing up around the state. Now, the university lab at U of L and UK, the labs there both increased their testing. Some of the hospital labs did as well. But that's how it was addressed here. The challenge with that is that's not a long-term solution. And I think what Dr. Stack has been focused on is, how do we get to a more, healthcare financing system based lab testing. So how do we get insurers paying for it as opposed to CARES Act money, because there's a finite life on that CARES Act money. It runs out at the end of December unless it's reauthorized. So, and that's true for the contact tracing effort as well. That's all federal funds, and there's a cliff coming. So hopefully Senator McConnell will lead the Congress through that. But nevertheless, that's a real issue for us. So right now the capacity, if we didn't have that relationship with Gravity and Blue Water, I think we'd really be hurting here in the Commonwealth, and we've got to figure out a way to have that similar or greater capacity with a sustainable level of financing or funding for it. And I think that's the job that Dr. Stack's focused on at the moment.
We've got 2 more questions and 3 minutes, so let's see if we can get through them. If the number of undiagnosed positive cases is already higher than the number of people now being tested, what is your best guess of what the fall-winter season will be once we're in flu season, pneumonia, and COVID-19? Is this being discussed in Frankfurt?
Yes, it is. I just listened to the clinicians and the experts in this area. I mean, that was the other thing that Dr. Stack was talking about yesterday, and in a hearing he had with some legislators in Frankfurt this past week, was about the flu season and the importance of getting a flu vaccine. I think that, and Dr. Furman, you can chime in on this, but I think most physicians believe that the combination of COVID and the flu season will be pretty tough for us here in Kentucky and across the country, frankly. And I think most of the epidemiologists and clinicians that focus in these areas, particularly with virology and infectious diseases, fear that we have a real, we have a significant uptick coming.
Right. Just in general, the hospitals and the offices and the clinics are always just more full in the fall and the winter. People are just sicker. So then you add COVID on top of it. But maybe if everybody wear their mask and wash their hands and stay 6 feet away, then there'll be less flu. I mean, right now they were seeing less flu at the very beginning, like February, right. March, when all this was happening. So
that's right. And there was a lot of hand washing in February and March because I know my wife, she'd send me to Kroger, and when I got back, the groceries would go on the table out back and she would disinfect them. That's when we thought that the transmission was by contact more than by aerosol. But hopefully if we do the things Dr. Furman just mentioned, maybe we can contain it.
Last question from Andrea. Can anybody here speak to the efficacy of the saliva test that just got FDA approval? Will they be readily available across the state soon? I believe it's called Saliva Direct.
Yeah, I don't know that I can, speak to the efficacy yet or the availability. I think we all think that there's perhaps an inflection point coming with the approach to testing, and that saliva test will be, just one component of that. But clearly a more rapid, approach to testing where you get a quick result, even if you give up a little bit in terms of accuracy or reliability, rather. then, I think that generally is going to be a good thing. The PCR test is still the most reliable, but it unfortunately is the one that takes the most time to do and has the most limitations in terms of capacity. So hopefully the saliva test, the efficacy of it will be quite good, and it will help in the response. It's a great question, Andrea.
Mark, thank you so much. This was a very engaged discussion. We're exactly at 11 o'clock, and there was a lot of questions. We really appreciate all your answers and all your wisdom, and we want to wish you well going forward in the fall and dealing with all of these issues related to contact tracing. Thank you for what you do. Yeah,
thank you for having me
with us. Thanks, everyone. See you in 2 weeks. In 2 weeks, September 1. Just be aware, we're going to have another session September 1. Bye.
Bye.